Good afternoon. Is it on now? I can't tell. Oh, I'm speaking directly into it. Thank you. I'm Ann Dunkelberg. I'm Associate Director with the Center for Public Policy Priorities, and I appreciate the opportunity to testify today before the subcommittee on the proposed. I've sent around very short testimony. I'm just going to touch on 6 different issues that we'll be talking to your offices and your staff about during the session. The first one is one that you've already had some great testimony on. It's the need to improve eligibility systems for children's Medicaid, the children's coverage issue, and the need to do something about the fact that unfortunately our uninsured rate for children actually went backwards in 2017. A loss there. There's a graphic there that if you have your reading glasses, your magnifying glass, it goes into some of that complicated structure of how we do eligibility for kids today that you were asking about earlier, and happy to follow up later. It's important to understand that we know from census data that over 400,000 of our uninsured children have incomes below 200% of poverty, and then using the best data available on immigration status, we can still comfortably estimate that at least 350,000 of those kids are, in fact, do have the status to qualify for Medicaid or CHIP. So we need to do more to get our eligible kids enrolled. The second issue that we wanted to register support for, and these are a mixture of items that we think will come up as a result of legislation that has been filed or will be filed, some of which are actually already in the exceptional item list. The second one is the proposals to extend the Medicaid maternity coverage period to 12 months after the baby's born instead of just the current 2. And obviously that's not in the exceptional item list, but it's something we would strongly support as a means to reduce maternal mortality and morbidity, improve care for pregnant women, and hopefully we can even move to improve care for women before they get pregnant. We're also very much support exceptional item number 5, the $71 million to improve our ECI programs funding and allow them to recover some of the capacity that they've lost. We know we've lost. There's great research from Texas Care for Children that has shown a loss of providers, as well as a reduction in funding for per child compared to 2011. Just haven't. A fourth item on our list is Medicaid managed care oversight and performance improvements, and you do have 2 exceptional items, 9 and 18, that we would very much support, but we're also anticipating that we will see other legislation. Some legislation has been filed. We anticipate more will be filed, and that it may very well be necessary for some additional to be made available to the agency to really wrap their arms around the enhancements of oversight and consumer support we hope we're going to see coming out of that work. As always, we like to mention attendant care rates. Exceptional item number 36 calls for $150 million for a 50-cent increase in the base rate. And we would note that, sadly, that only takes us to $8.50, which will still leave attendant care well below many fast food restaurants, many big box stores. And given the sort of the critical role of attendants in our long-term services and support system, we hope that we can make even more progress than the exceptional item. The final item that's on there, and I'm pretty sure I heard my bell was up. Is that right? So I don't want to drag you too far into that, but there's some data on the back about our concern about the phasing out of both the funding and the services from the 1115 transformation waiver, and that we need to be looking hard and thoughtfully for ways that we can keep both those services and those funds coming to Texas and hopefully do even better. And we believe, along with many other advocates and other Texans, that one of the best ways that we can do that is by finding a coverage solution for our low-income adults in Texas. It will allow us to provide many of the waiver services as well as provide better rates for our providers. I have one more thing I would like to say on behalf of Eva DeLuna Castro, who, for some reason, even though she's our budget expert, is not the one talking to you today. But some of the analysis that she has done of the fiscal situation that we have, one of the things that has jumped out for me is that as a percentage of Texas personal income, in 1991, we were taxing at about almost 4.9% of Texas personal income was being collected in the state tax. Today, we're down to 4%, and the difference that that makes, just for last year, for 2018, we would have had $12 billion in additional tax in Texas state tax. So it's just important to remember that it's not just, in addition to the challenge of keeping up with cost growth and population growth, we have also shrunk the pie, and that's part of the reason we're struggling with this. And it is a painful reality that we may need to look at more as we deal with the challenges.
Thank you, and I appreciate your comments, but we still have, regardless of whether it's 4 or 4.9, we obviously have a spending cap that's a completely separate subject. That the rate of growth of the state budget cannot exceed the rate of growth. So absolutely. It's not just as simple as.
I believe we've stayed comfortably below that.
Yes, we have, but
so, and that may be one of our challenges.
I don't know that we could if you were talking about $12 billion, right? If we would be staying.
That is an excellent question that I will pose to Ms. DeLuna, and we will get back to you. That's right.
So I just say, careful with the numbers, because even if you were to collect it, it doesn't mean that we could appropriate it.
I think that's a great point, and I'll be sure to get that back to you.
And thank you for bringing up the subject of those demonstration projects. That's something that we all need to be